My name is Nazri. I'm currently practicing in Assunta Hospital, and I specialize in sports surgeries on the knee. First of all, thank you, Dr. Vijay, for inviting me over and giving me the opportunity to share to all of y'all in regards to arthroscopic surgery. Right. So you may ask, what is an arthroscopic surgery? Right. So we take the word arthroscopy and you break it down. Right. Arthro means joint. Scopy means camera assisted. So basically what we're doing, we're taking a camera, putting it into your joint and performing the series that we need to do, all right? It is a minimally invasive. Why I say that? Because it only takes two little stab wounds. You don't cut the joint open. Two small wounds measuring about 1 centimeter each, that's it, all right? Now, it is used to diagnose and treat a wide range of injuries involving the shoulders, elbows, wrists, hip, knees, and ankles. I bold and underline the knees because that's the area of my focus, right? This is the actual arthroscope. This is the instrument that we use to insert into your joint, right? So basically, it's made up of a handpiece, and this long rod-like structure is the actual lens that will be introduced into your joint, right? Now, this console is then connected to a HD screen, and this is where we see and we perform the surgeries that we need to do, right? All right, like I said before, an arthroscopy is a minimally invasive surgery. Why? Because, like I said, you only need two little stab wounds over the knee, with one wound where we'll insert the camera, and in the other wound, we'll insert instrument to help us perform the surgery, right? So this is another picture on how we insert the arthroscopy into the joint. Okay, now as a surgeon, it is detrimental to know how to operate, but it is also important to know when not to operate, okay? So like Dr. Kamalji has explained, not all sports injury requires surgery, all right? There are roles of conservative management and it really helps a lot, right? But there are also instances where surgical treatment is the only way to go. All right. Now, what are those treatments? What are those conditions? Yeah. All right. ACL tears, a very common sports injury. All right. Particularly those involved in non-pivoting sports like badminton, tennis, hockey, pickleball. All right. But not all ACL tears require surgery. Okay. Now, when do you need surgery? When you come to me and you say, doctor, I had a fall. I heard a pop sound in my knee, having pain. But I also have functional instability. Now, what does functional instability mean? Meaning when you're performing your daily activities, when you're walking, going to work, going upstairs, getting out of the car, you feel as if your knee is giving way. Now, that is functional instability. You need to get something done. You probably need an ACL reconstruction. If you don't have any of those, but the MRI shows you have a tear, you're feeling fine, you have no instability, no need to do anything, just do your therapy, painkillers, and you'll be fine, right? Now, the ACL is an anterior cruciate ligament, which is the front of the knee. You would also have a PCL, right, a posterior cruciate ligament, which is located at the back of the knee. Now, this can also be reconstructed, but very rare, right? Now, another common injury that we get is a meniscus tear. Now, what is a meniscus? If you look at this picture here, a meniscus is a C-shaped structure, right? It's stuck on your shin bone. You have two, one on the outer part of the knee and one on the inner part of the knee. Now, these meniscus, they're prone to get injured, they're prone to get tears, right? So you see it's a tear. This is a normal meniscus here, and you can see here there's a tear. Now, most of the time, patients with meniscus tear will come with symptoms of pain and swelling, all right? And most of the time, if you have a tear, it is always better to get it fixed. Now, what happens if you don't repair the meniscus? Three things can happen. Number one, the tear can propagate. Because when there's a tear in the meniscus loses its tension. The tear, it becomes weak and the tear can become bigger and bigger. Now, what is the consequence of that? When that tear happens, part of this meniscus can be dislodged into the knee. Now, when that happens, you will get a condition called a locked knee. Now, what is a locked knee? You flex your knee, but you're unable to extend the knee. Okay, it's locked because there's a mechanical structure blocking the range of motion of the knee joint. So, what is the third thing that can happen if you don't fix your meniscus? See, the meniscus is like a shock absorber for your knees. It protects the cartilage. When the meniscus is injured, osteoarthritis sets in. And when it sets in, the degenerative process of the cartilage can be accelerated because your shock absorbers are no longer there. All right? So how do we do it? By the use of specialized implants and sutures, right? Put into the knee joint and get it fixed, right? Okay, another common spot injury around the knee is cartilage damage, right? So you can see in this picture over here, this is the knee joint, this nice whitish area here, and this is the cartilage. When you look at this, a small hole here, there's a damage of the cartilage there. So this is the actual picture that we see when you put in the camera into your joint. Look at this whitish area, this is a nice cartilage, but there's a big defect over here. This yellow color here is the bone. So when the bone is left bare, this is the one that's going to cause you pain. So there are ways to tackle this problem by using specialized cotton gel-like material that we insert into the defect, and over a period of 2 months, that defect gets closed up and it heals as if it's like a cartilage. Not a pure cartilage, but some sort of a cartilage, right? And that will alleviate the pain. Okay, sometimes when you have a spot injury, you may have fractures. Small tiny bits of your cartilage or your bones get chipped off, and that can get dislodged to the joint. Also, this can cause pain and mechanical block. So what we can do, put in the camera and remove those blocks, right? Okay, what are the advantages of the knee arthroscopy? Like I said, it is minimally invasive. I only need 2 little stab wounds. All right. So smaller the wound, less the pain. You don't need to stay in the hospital for too long. A minimum of 3 days, 2 nights. That's it. You're good to go. All right. Because the wound is small, there's lower risk of infection, and rehab can also set in faster. All right. Okay, now the common question is, when can I return to usual activities after a knee arthroscope? The rule of thumb is 2 weeks, all right? We need 2 weeks for a couple of reasons. Number one, for the pain and swelling to subside, and also for the wound to heal. You will be able to return to work, but sometimes it depends on what the condition that you've operated on. You may need to use a crutch or a brace. When can I resume sports after an arthroscopic surgery? All right. If you have an ACL tear and it has been reconstructed, the rule is after 9 months. If you have a meniscus or a cartilage repair, return to sports is after 4 to 6 months. Right? All right. That's it. Short presentation.